Hello, my name is Roberta and I'm a public health nurse in Wexford. Firstly, thank you all so much for sending in your questions today. These questions will help guide today's talk and hopefully we'll be able to answer all those questions to the best of our ability for you. Please note that this talk is not to replace your child's developmental assessment. And if any of you have concerns in relation to your child's developmental, please contact your local public health nurse or your GP. Now, if any of you are unsure who your public health nurse is, please contact our local public health office on 053 912 3522 and ask to speak with Molly. Molly will be able to guide you in the right direction. So for today's talk, I'm going to focus on your baby's 3-month developmental assessment. Unfortunately, due to COVID-19 restrictions and guidelines, a lot of you have not been offered an appointment for your baby's 3-month developmental checkup this year or for a large part of last year. So this is a really good opportunity for us as public health nurses to be able to, give you plenty of information on what you should be looking for in your baby's 3-month developmental and also what you can do to help your baby develop their milestones. So, for a lot of you, the last time you would have seen your public health nurse was at your baby's primary visit. This was the visit when the nurse came to the home when you came home from hospital. Well, the next check that we do as public health nurses is your baby's 3-month developmental assessment. And part of this assessment is a physical assessment on your baby. Now, this sits really well with one of our first questions today. And this mum has wrote in, and what she has asked is, what checks should we be doing? Eyes, ears, spine, etc. What should parents, carers, givers look out for? Okay, very, very good question, a very relevant question to today's talk. So after birth in the hospital, a midwife will do an immediate physical assessment on your baby. Up to 72 hours post-delivery, a doctor or a very specialised midwife will also do another full physical assessment on your baby. Your baby will be offered a newborn hearing screen, and your baby will also be offered a newborn blood spot screen within 5 days of being born. Then, when you and baby come home from hospital, a day or two later, you will get a visit from your local public health nurse, and she again will do a physical assessment on your baby. Now, she will also give you this book. This is a very good book. It is a HSC book, and it's called Mychild, not to 2 years. There's also a website, Mychild.ie. Now, again, if you have not received this book, please contact your local public health nurse and we can arrange for this to be posted out to you. Your baby at this stage will also have received any time from about 6 to 8 weeks their checkup with your GP, and baby will have had their first vaccination. So part of baby's developmental assessment, we would be doing a physical assessment on the baby. So we would be looking at their head, their legs, their arms, their hips, their eyes, their ears, their nose, their mouth. We would also be looking at your baby's gross motor and fine motor skills. We would also be looking at their social and language developmental. We also would do a record of your baby's weight, length and head circumference. A steady weight gain is a sign that your baby is thriving. And just be mindful that all babies come in different shapes and sizes, and all babies develop at different stages. We would plot your baby's growth on our World Health growth charts. So these are Ireland, UK World Health growth charts. Each baby would have got one of these at birth, and we have one for boys and one for girls. So as parents, what can you be looking for to ensure that your baby is reaching their milestones? So at about 12 to 14 weeks, your baby should be kicking vigorously, should be using both arms and legs to kick vigorously. Your baby may very well have started to looking at their own hands. They'll be able to pull their fists up to the midline of their chest. They may very well be putting their hands in their mouth and exploring, and this is a really positive thing to see with baby. They may also starting to be look around, and they'll be more alert and active during the day. They may also start to be engaging with you. They'll be smiling at you, they'll be laughing at you, and they may even start being vocal with you in that they'll be cooing to you. And this is a really nice time for mum, dad, caregivers, and baby. Okay, they'll also be able to, if you put a little rattler in their hand, they'll be able to hold that for a second or two. So what can you do as a parent to help them encourage to do their milestones? Well, babies are very physically active and they need to be active a couple of times a day. One way we can encourage baby to be active is giving them loads of tummy time. Now, tummy time is really good for their head, neck and back muscles. And it's also a lovely time for you and baby. So what you need to do, or what you can do, is put baby down on their tummy, make sure they're well supported with their hands out in front or their hands beside them, and never, ever, ever leave baby on alone, unsupervised when they're on their tummy. You as parents can get down, get loads of age-appropriate toys and encourage your baby. Look at your baby, smile at your baby, encourage your baby to lift their head. There's a very good article in this book and it's on page 129, just on tummy time and the benefits. And there's also a lovely, lovely picture of mum and baby doing tummy time. In relation to your child's developmental, again, there's another lovely section here on page 125, your child's growth and developmental, and that's really, really good as well. And also just be mindful, if your baby falls asleep on their back or falls asleep on their front, always make sure that you put them back to sleep safely on their back. If any of you, again, have concerns in relation to your baby's milestones, please contact your local public health nurse or your GP. So following on from the first question, we got a second question, which is very relevant as well to baby's milestones. And this question was, what age should baby be making eye contact? My baby is 3 months and looks at objects, but not at me. Another great question. I'm really glad you asked this. Babies can see from birth. From about 6 to 8 weeks, your baby should be looking at you. Your baby should be responding to you. Your baby should be using 2 eyes together. And if you hold a nicely coloured toy about 20 centimetres in front or above your baby, they should be able to track and follow that. Now, some babies are born with eye problems. Some babies develop eye problems as they grow. If any of you have concerns about your baby's eyesight, again, please contact your local public health nurse or your GP. So another really good part of the 3-month developmental, and something that we would often spend a bit of time on, is baby's weaning. Okay, so this coincides with a lovely few questions we've got in relation to weaning. And the first question we got was, parenting websites and forums recommend giving baby their bottle as main source of nutrition first and then feeding solids after each meal. Thank you for this question. As a PHN, we are often asked, to recommend baby forums or websites. Now, we have put together a small list of resources that we would recommend for all parents, and the library is going to put them up following my chat today. So weaning is just great, okay? Weaning is a really exciting time. And what we mean by weaning is that your baby is developing on, okay? They're still going to be taking their milk and their breast milk, but they're also now going to be starting on spoon feeds. And the first bit of advice I give parents before starting weaning is to get yourselves a copy of this book. All right. So this book is Feeding Your Baby, Introducing Family Meals. Very basic, very practical book. You can get this book on www.healthpromotion.ie. Again, if you want to contact your public health nurse, we can arrange for a copy of this to be posted to you. So this mum has asked, when do we start weaning? When is the best time? How much do I give? Okay, so weaning, the World Health Organization has recommended that weaning starts anytime from 17 weeks to 26 weeks. Okay, so you might ask as parents, why do we wait for 17 weeks? Why can we not start earlier? World Health has advised that babies' kidneys aren't mature enough, that their digestive systems aren't mature enough, that physically maybe they're just not strong enough, their head control isn't that good yet. Also, babies that are spoon-fed too early, they say now it can increase the risk of obesity later on in life. So why do we not leave it later than 26 weeks to wean? Their iron stores are depleted. So what you have passed from mum to placenta expires after 6 months. So then we need to start supplementing with food. Also, for their oral stimulation, for their speech, we need to get the muscles moving. So that's why we don't leave it later than 26 weeks. So when do you start weaning? What's a good time? We always say, make sure baby isn't too tired. Make sure baby isn't too hungry. Make sure you're not too tired. Give yourself plenty of time to do this. It can't be rushed. Also, we would advise that you turn off the telly, that you turn off your mobile phone. This is just about you and baby, and you would start mid-morning feed. So let's say they're due a bottle or a breastfeed at about 11:30. Give them half their breastfeed or half their formula feed. And then we would advise that you give them a little bit of tin watery puree. All right. And what I mean by a small amount, I would just say 1 to 2 teaspoons max. Let them put it in their mouth. Let them spit it out. Let them spit out their tongue. It's only about fun and getting baby used to the idea. When you feel your baby has had enough, I want you to give them the rest of their breastfeed or give them the rest of their formula. So introducing solid food to your baby's diet will gradually reduce the amount of milk feed that they need. So for example, weaning takes place in 3 stages. Stage 1, stage 2, stage 3. By stage 2, when baby is about 6 to 9 months, they will be averaging about 3 to 4 feeds of milk per day, and that would be averaging about 600 mils per day. Now, another few questions that we had very kind of related to weaning was, can I give my baby fruit juice? What can I give my baby to drink? Until a baby is 6 months old, all they need is either breast milk or formula. From 6 months old, if you feel your baby needs additional drinks at snack times, after meals, we advise cool boiled water. And we also advise that this cool boiled water is given in a beaker. Fruit juices, fizzy drinks, no, we don't recommend them. They're full of sugar, they will decay your baby's teeth, and they'll also fill your baby up. Tea inhibits iron absorption, absolutely not suitable for a baby, and caffeine, absolutely, again, not a suitable drink. If you want to give your baby something, probably a natural fruit juice, and we would be advising that this would be very, very well diluted. So 1 portion of fruit juice with about 8 to 10 measures of cool boiled water. And finally, the last question we had on weaning was in relation to general store bought cereals such as Ready Brek. Are they okay to give your baby? Another really good weaning question. Now, I know I've mentioned it before. Weaning comes in 3 different stages. Stage 1, stage 2, stage 3. From stage 2, baby will be between any age between 6 to 9 months, and we recommend porridge or whole grain cereals which are low in sugar and low in salt are absolutely suitable for your baby. One question that we've got a lot of questions about, one topic that we've got a lot of questions about is about cow's milk dairy allergy. So we had one really good question here from a mum. She has an 8-month-old baby and her baby has cow's milk dairy allergy. Diet has been exclusively dairy free. When would you recommend introducing dairy foods, or should this be avoided until baby is a toddler? Okay, food allergy is an immune response to a specific food protein. 4% of Irish babies have food allergies. And cow's milk protein allergy is less common, with about 1 in 100 babies experiencing it. Food allergies can be immediate in that the symptoms can happen maybe 2 to 3 minutes after taking the food, or it can be slightly delayed 1 to 2 days after consuming the food. In response to this question, I feel that this would need to be referred back to your paediatrician or dietitian for further assessment and safe introduction of weaning. And the last question we have today is about a mum with a preterm baby. And is there anything additional that she should be doing or looking for with her baby? Oh, look, congratulations on your baby first. Having a baby born early definitely does bring a lot more stress. All right. A premature baby is a baby born before 37 weeks gestation. So a baby born at 40 weeks is a full-term baby. A baby born before 37 weeks is a preterm baby. And usually babies born preterm will receive extra checks from their public health nurse, and they should be under the care of a doctor or a paediatrician. But really, the advice is they will be slightly later to reach milestones. And the final question today is, when and how and when will we be resuming our clinics? This is a look from all the questions that came in today. It's obvious that the public health nurse service is really, really valued. We have always put, our patients and our babies first, and we have followed COVID-19 restrictions and guidelines. In resumption of our clinics, we will have to follow national, regional and local policy. So we really look forward to opening the doors again and welcome you all back. And thank you so much for taking the time to listen to our talk today. We really look forward to seeing you soon. And please, if any of you have any questions, just pick up the phone and ring your local public health nurse. We'll be more than happy to speak with you. Thank you.